East Village, good morning to you. It's 7:50 on Monday morning. Well, a local congressman has an idea that is focused on both health care and illegal immigrants. Joining us right now is Brian Bilbray. Congressman, good morning to you.
Good morning.
I want to say, first of all, I know we want to talk about health care, but I want to check your temperature on Afghanistan. The U.S. commander in charge is now saying that if this thing is going to work over there, we need to have more troops. What do you say?
I think that we've got to give the commander in the field the benefit of the doubt. You know, as the ranking member on procurement and government oversight there's a dirty little secret that we are not talking about. You know, we talk about nonprofits here like Acorn and Problem Zero, but no one's been looking at the nonprofits that were supposed to be doing the economic development in Afghanistan in the last few years. And there's some of us that are working on this issue that I think the next big scandal you're going to see with nonprofits is people that were being given money in Afghanistan to do economic development, and that money wasn't used for what it's supposed to be. So I think we need to go back and look at what we're doing on the economic and the community building while we're giving the troops the resources they have. Because you never want to deny the troops in the field what they want, but I think what they need even more than more troops is a viable nonprofit system that's not perpetuating corruption. And I think we got a major problem there. And that's one thing that you don't hear very much about. You keep hearing about what happened in Iraq with the for-profits, but everybody's ignored the nonprofits down in Afghanistan.
So basically you're with the president in that regard in terms of assessing the situation before you just start sending more troops over.
I think that you do, but you've still got to, you can't play games with the guys in the field. You got to give them that. But I think that we got to talk about things that are not military there that need to be done, and that is, I think the Bush administration should have administered the grants that were going to nonprofits, and this assumption that if somebody's nonprofit, they must be okay. I think we got to revisit that.
We'll move on, but of course what you're talking about, an investigation that's going to possibly take far too long because the general is saying he needs the troops and needs them now.
Well, he will get them now. I can't believe that the commander-in-chief is not going to send the supplies. No matter who the commander-in-chief is, Democrat or Republican, the troops get what they need, and they better get it quick.
Yep. Let's talk about health care. Of course, the president was all over TV Sunday morning. Yesterday morning, he's going to be on David Letterman tonight for an hour. In essence, what did the president say to the American public? And in fact, what did he have to say?
Well, he's trying to basically say, look, we're not talking about what you're hearing. The trouble is the president is talking about a proposal that no one has seen, and I think that's one of the biggest issues. You got to understand that the big problem you have in the House of Representatives, you got Henry Waxman's proposal, and that was the only thing that was being voted on and was in writing. So when the president now is talking about, he's talking about concepts, but not actual bills, because he keeps going back and forth. If you remember his speech, he said, my proposal does this and my proposal does that, and that was totally separate than the Waxman proposal.
But in terms of specifics, Congressman, what would you like to have heard the president say?
Well, first of all, that flat out, the one way we're going to make sure, when he said no illegal immigrants are going to have access, then he needs to say, and that is why we're going to require verification that no one's in a program unless they've been checked. Because if you don't do that, there's no way you can keep illegals out of the process. And in fact, if you don't require it, there's no way to check, because people then say, oh, it's selective enforcement. And let me tell you one thing about this issue. This is not just an issue about money or people getting health care. It is a signal we're sending to people that may consider coming here illegal. If America says, look, we're going to draw a very bright line between legal and illegal immigration, so that we send a signal to people around in the world that, look, you want to come here legal, because we're going to make sure you don't benefit from illegal immigration, because we're doing all these checking now, things we should have done 20 years ago.
So basically you're saying, listen, if you come to our country and you're legal, you have documents, you're doing the right thing, you can have access to health care insurance.
Yes. And you know, that is a debate that we can make among ourselves, but you got to send the message that we are checking now. You know, this concept of saying that there's not going to be any illegals in the system, but we're not allowing people to check, that'd be like having a speed limit with a sign underneath that says no law enforcement officer will give tickets on the street. You've got to have enforcement to make the rules apply.
And of course, you know, this is a very much a hot button issue. So you're saying if in fact that folks are here legal and they should have access to health care, you think that will quell the storm from folks who are saying, oh, illegal immigrants, oh, I don't know where to send them home, all this craziness.
I think that there's been a good service in this whole thing, because from now on, this isn't just health care. Now on, if you want a public service, if you want to get the taxpayers to subsidize it, then you have to prove you're here legally. And I think that's going to be a standard for everything. I think we're going to see this move right from benefits to voting and everything else. I think these issues of verifying that the right people are participating in a program is going to be a minimum standard that everybody is now going to say, this is just what we got to do. We should have done it 20 years ago.
Where do you stand on required health insurance?
I don't think that the federal government is at the point of mandating people have to have health insurance. And for the president to talk and compare this to car insurance is totally different. Driving is a privilege. It is not a right. But living in the United States for a U.S. citizen, that is a right. And for the federal government to say you do not have the right to be in this country unless you have insurance is something I'm not so sure we're ready to make that leap. And I don't know, constitutionally, we're going off on some really different areas. It's one thing to provide a program like Medicare. We can do that. But we don't mandate people onto that system. And when you get into this other aspect of where you're providing, you're doing mandates in Social Security and Medicare, which we've done, that's been under the tax code. And that tax code was a constitutional amendment. We've got to be very careful when Washington starts mandating individuals make these individual choices.
I've got about 10 seconds for you on this. I'm sorry to give you this short time, but I want to ask you this. Do you think Congress and lawmakers need to tighten their budget in terms of their travel spending?
Well, I think I think that you've seen that reviewed really. It is a privilege. It is not a right. But living in the United States for a U.S. citizen, that is a right. And for the federal government to say you do not have the right to be in this country unless you have insurance is something I'm not so sure we're ready to make that leap. And I don't know, constitutionally, we're going off on some really different areas. It's one thing to provide a program like Medicare. We can do that. But we don't mandate people onto that system. And when you get into this other aspect of where you're providing, you're doing mandates in Social Security and Medicare, which we've done, that's been under the tax code. And that tax code was a constitutional amendment. We've got to be very careful when Washington starts mandating individuals make these individual choices.
I've got about 10 seconds for you on this. I'm sorry to give you this short time, but I want to ask you this. Do you think Congress and lawmakers need to tighten their budget in terms of their travel spending?
Well, I think I think that you've seen that reviewed really heavy. I mean, I was kind of funny. I actually got just attacked in the paper over going into the revolution on Honduras, where we went in to basically meet with everybody on this. It's not, and someone said, oh, it was a resort trip.
I'm not implying that you're doing it, Congressman. No. I'm just asking you in general. Do you think you guys up?
I think that we need to look at what are we doing, where are we doing. Is it actually business or is it a junket? And I think we not only have a right, we have a responsibility to take a look at those things.
Indeed. Congressman Bilbray, always good to see you. Thanks for stopping by. All righty, coming up.